So basically, you know, what we've talked about right now with Hunter and Mike and what Richie's alluded to is these principles here of the intensity being 3 or 4 out of 10, maximum stretch, 60 seconds, which we've talked about before. And I'm only giving you guys a quick review. It takes about 30 seconds to move from the middle of the muscle belly out towards the myotendon junction. And that's the key. We have to work the myotendon junction. That's where 90% of all injuries happen. Once per day, 2 hours post activity or preferably before sleep. We talked about stability, balance, and control. We looked at the kinetic chain versus the micro stretching chain. So as you saw in Hunter's progression, there was a method behind why we took those stretches and put them together, specifically the hip flexors, the IT band, and the glute piriformis, because we were trying to relax what was happening up in his hip area. Because as you got to realize, what's happening up at the hip will affect what's happening down at the calf area and vice versa. And then basically, to quickly reiterate, you don't want to force a stretch, because if you're forcing a stretch, you're contracting. So the guy on the left, he's putting a lot of pressure on the person's knee. It's not a stretch, it's a contraction, it's a pain, it's a sympathetic response. The one on the right is basically, now what I would do, and Mike and I talked about this, is I would actually introduce pillows. And Mike's right, because leaving the legs freestanding this way in a butterfly position is basically, it may not allow the muscles to relax properly. And also you could actually engage the hip flexors.
Nikos,
Yo.
Can we go back for 1 sec? So with the stretch on the right, we were talking about how for a lot of athletes, I know myself included, especially hockey guys, we always have tight hip flexors. So believe it or not, my legs never get in this position with how low they are. So I would recommend that if people are stretching and they have really tight hip flexors, that before you go into this stretch, you would actually stretch the hip flexors first, because when I do this stretch, I don't feel it in the adductor region. I feel this primarily pinching in my hip flexor area, whether it's the pectineus, which is around the groin group, is really hard to depict. But I would say if you want to make sure that you're getting more the adductor group, if you were to stretch the hip flexor first, if you know that they have tight hip flexors, that'll help with that stretch. So I just want to throw that in there.
And that's precisely, oh no, and that's a good point, Mike, because that's the one thing we've talked about in the past with the group and with yourself, is that if you're focused on one muscle and another muscle is being activated, then that's telling you that the other muscle, this goes back to the using a live diagnostic tool, which is what you and I've talked about and what Tom's alluded to in in one of his lectures as well, Tom Walsh, is that you basically can use stretching as the person is being put into that position to give you an indication of how the person is feeling, what he's feeling. And that's precisely correct, Mike. A lot of hockey players yeah,
I think we lost you, Nico.
how's this?
Yeah. Yeah, we lost them.
I read your book, Jimson. It was a good book. I read that. I read it a long time ago, but it was a good book nonetheless.
Which one? Sorry, thank you. Which the Rocket Start? Okay, thank you.
Mm-hmm. Yep. Well, because I used to powerlift, right? and the guys at Westside on their podcast, they don't shut up about you. So that was 3 years ago. I'm like, who the hell is Jimson Wayne? So yeah, I read the book. That was in 2017, but yeah, good. Well done. I enjoyed it.
Well, thank you. Yeah, thank you. I love track and field, as I think it's obvious.
You also wrote a blog that I think I read a while ago that I've used with myself training along with my athletes about where your eyes are and your gaze, about staring off into something in the distance, right? That's not very obstructive, where if you look closer, it's going to distract you and throw off your concentration whilst running. I thought that was amazing. I thought that was brilliant.
The funny part, if I can hijack here for 2 seconds, I think
Jimson's got some really good ideas.
yeah, this nothing to do with microstretching here, but I know Valery Borzov made it famous by using little lights and lamps along the way his track, and he knew on his 60-meter acceleration he had to just follow the lights, kind of like what we saw at the Impossible Games, and I actually got a set of those lights from Italy, and I couldn't use it. I couldn't run a 60-meter sprint and follow the lights because my eyes are so focused on running ahead, and even just the distraction of looking at lights and where I should be doesn't work. They actually make those lights again in the US. If you go to Simply Faster, they actually sell it. But I know from my experience that, well, one, in bright daylight it doesn't work. So if you train at dusk, it works. If you train indoors, it works. But I just couldn't use the lights. So,
yeah, and I mean, I think that might work with beginners or youth, right? Like, because they're not hitting the outputs that so they can have a little bit more forebrain activity by concentrating on a light, right? Wouldn't you agree?
Yeah, but Valery Borzov is going at 11.9 meters per second, right? He's
I have no idea who that person is. So yeah, okay, yeah.
So this was back in the 70s or late 60s training, but good point on the eyes. On the eyes and gaze, but yeah, I don't want to hijack Nico here. Sorry, Nico. Now that you're back, we can resume back.
No, you're not hijacking me, because actually this is good, because eventually we're going to segue in recovery regeneration forum.
Yeah, I think you're having internet issues still, but anyway. Welcome to COVID-19.
Need another mic there, Nikos.
Oh, he's gone again. Yeah, challenging times. What can I say? We'll give him a second to get back. Since we're waiting for Nico to come back, maybe I can ask Hunter another question. So back to your training. Do you find yourself more on the, like the power lifter / weight training kind of training, or are you more on the plyometric ballistic kind of training for your specific like body type?
Oh, for right now, where I'm at right now, Jimson?
Or now, and your goal is to hit under 11. What do you think is your supplement? Obviously, running is the best way to get faster, but what is your next best supplement training that will make your goal?
I hardly spend any time in the weight room anymore. I mean, as a powerlifter, I got that huge strength reserve, right? So, I still do lift weights, Jimson. It's just so secondary. It's not even funny. But to answer your question, I think that I've gotten the best carryover from bilateral ankle jumps. I like those. I mean, they make my feet feel strong. I get snappier off the ground, and from an analgesic standpoint, it makes my Achilles and calves feel really good. So,
yeah, I agree with you. I got like a bunch of 8-inch little mini cones, 8 inches high, and I do just one-legged hops on each over the cone, If I had hurdles, I'd do it, but or little tiny hurdles, but the cones work great. And yeah, I find that better than weight training, but that's for another discussion.
Yeah, I mean, well, I'm so jacked up from being bigger and as a powerlifter. So like everything I do in the weight room is very what do I say? It has a Bill Hartman twist to it. So there's a lot of PRI incorporated in there. So like today I did some inhalation biased unilateral rowing, and then also feet elevated or heels elevated Zercher squats, just to keep this expansion forward and back up here, right? So, but
Can I ask you a question, Hunter?
yeah.
You said you did a 7.5 60 meters. Is that still your personal best for 60, or is it quicker than that now? Especially if you're going-
It was a 7:58, and yeah, that's been my best. I think I only ran two 260s before the outdoor season started last year. So
Because to run an 11.1 or under 11 second of a 7.5 60 is doesn't really compute Jimson much, does it? A 7.5 to an 11.1.
Yeah, I think.
well, I mean, you also have to take into account how much better I got throughout the season.
Mm-hmm. That's why I was asking if you've managed to quicken the 7.5. Are you going to do another one soon?
Well, the nice thing about Arizona is that you can just drive up to Flagstaff and do an indoor meet up there, right? So if that time comes, as of right now, Alan, to answer your question, yes, I will be doing more indoor stuff. When, I have no idea. The plan right now is let's just make sure that we can get through, a month of uninterrupted training, healthy and feeling great. And then Derek wanted to do some time trials, so we can set up. We might do some mock meets, but I don't know the next time I'll actually get with a real gun and fully automated timing and all that stuff. So,
Hunter, you said you were 242 when you ran that.
To be exact, I was 258 that day.
258.
Yeah.
One of the most impressive things, and Malcolm, I think you were probably there. One of the most impressive things I ever have seen my entire life. I'm pretty sure it was 1984 indoor meet at LSU. I was standing on the walkway rail, 8 lanes, 60-meter indoors, and Bo Jackson had played at the Sugar Bowl 2 weeks before. So he still had his football feet. He was wearing a black bodysuit and a gold chain in January 14th, but it was still pretty darn fast. And it was the most impressive. Do you remember him running that?
Yeah. Him and I'm trying to remember one of Herschel Walker's somewhere, and I can't remember what that was. It's just these big bodies moving so quickly. It's just astonishing.
Yeah. Just impressive.
Yeah.
Nikos, you back? We keep losing you.
Don't forget Ray Lewis, man. Ravens, Baltimore Ravens. What was he running? Like a 4.2, and he was massive, 280 pounds.
Hand
What about Ron Brown in '84 going up to the Olympics? Going back to the LA Raiders. Ron Brown, remember him? Ron Brown and Sam Grady from the '84 Olympics.
Sam
When
Grady.
they went back to the NFL, they weren't even the fastest guys in the NFL because Darryl Green from the Redskins beat them in the 40-yard dash. These guys have just won the Olympics.
Hunter, here's the thing. If you're invited on to speak to a bunch of old guys, you got to do some little research. You don't know who Larry Bortzoff is.
Yeah.
Olympics in 1962.
You should have told him, Jimson, that he was an Olympic champion, 1972.
1980 gold medalist.
Yeah, 1 and 2.
Yeah, the names are familiar, but I do not remember. I was not around to see any of those things for sure.
And don't rub it in.
Yeah.
Hey, folks, who wants me to kick him off? I can remove him right now.
There you go.
Go
Yeah,
ahead.
There should be an age restriction.
You and Mike are lowering in the median age of this group, so we can't go to you.
Oh, no kidding. No kidding.
Where were you in Germany when you played hockey?
I was right near Munich. So I was near Ingolstadt.
Okay.
Oh, Ingolstadt. Actually, one of my patients played there, Phil Von Stefanelli, years ago. He used to play for the Boston Bruins.
Nice town.
Ingolstadt is where Audi is from, guys.
Then Bayern.
Should I continue with this PowerPoint, or should we just have
Here's-
fun with this
Here's
chat?
what I kind of said this. I think everybody kind of agrees. Every time you go back in, you lose and get knocked off.
Okay.
I'd say maybe figure out or here's two things you can do. One, if you put any presentation you're going to show onto your phone, all you do is have to email it to yourself. Then if you have problems again, the phone may work better. I might be wrong, but sometimes it seems to work better than a desktop. You can get on the phone and you might not have as much problem.
I think the issue too is I had this Uber conference thing loaded on my computer, so I'm wondering if that was affecting anything.
I think it's just internet bandwidth.
Yeah, but I mean, it's ridiculous. We got fiber optics and everything, so it's driving me nuts. Here, let me try to
some stuff.
Let me try to finish this, and then then we can actually go next week or something like this, because I think what I want to show you guys, which is very, very important, is this thing. So you guys see the red blood cells, the white blood cells?
Yeah.
Okay. If we had a 200-pound individual, blood accounts for about 8% body weight. So in this case, it's 16 pounds. What I find very interesting as we continue is red blood cells are 45% of that. So it's 7.2 pounds, where platelets, everything else but white blood cells and red blood cells, is 8.68 pounds. So this is the thing that blows my mind away. 0.12 pounds is white blood cells. And interestingly enough, so you asked the question, I have often asked the question, why is this so important? And if you look at it, it's this thing, that the white blood cells determines, so believe it or not, 0.056% of the body weight determines the performance level of all athletes and the quality of life of patients. It's the white blood cells that are very important. That's what we look at with regards to inflammation. So the thing that I find interesting is, if you look at this, do you guys know this figure, this particular, where it's from? It has to do with the Black Plague in the Middle Ages. And this is what they used to wear. They used to wear this so they could still breathe, but look at the patients. So this was basically the Spanish Inquisition, whatever you want to call it, the Inquisitor. But what's interesting is that the Black Plague actually stems from the flea, which is carrying a bacteria on its body, which then it transferred to the mouse. So the Black Plague was a bacteria, Yersinia pestis it was called. And interestingly enough, this is a cytokine response. So is this. So this is what, here's some interesting facts. The Black Plague made it to America in the 1900s. And interestingly enough, and I say this a lot, 7 individuals are affected by bubonic plague annually in the States. So the Black Plague is still around. So if we think we're going to get rid of this COVID thing, it's with us for the rest of our lives right now, in our existence and generations to come. And this is what the Black Plague looks like. And so the other thing too is this, Ebola. The Ebola virus is what is known as a hemogenic fever. And it basically, you can bleed through all the orifices, the eyes, the ears, the nose. But this too is a inflammatory response based on cytokines. We talked about cytokines because that's what causes trauma to the body when you're training. It's a cytokine response, but it's acute, but you recover from it. If it becomes chronic, you can actually die from it. And this is what Ebola is, the bubonic plague is. These cytokines are little proteins released by the white blood cells that 0.056% of the body weight, which is your immune system, is determining how we're going to respond to our environment, which I find very interesting. This is the coronavirus. And what's interesting with the coronavirus is, if you guys can see my cursor, this half coronavirus thing, this is the RNA. So the coronavirus is a foreign substance. It goes into our lungs, as you can see this diagram here. And what it does is this RNA that's inside the virus itself, it actually, once the spike proteins here attach to the lungs, they release the RNA, and the cells of your own body now become foreign. And what the body then says is, the innate immune system says, hey, we've got something here that doesn't belong to us anymore. So this is when the cytokines come in. This is when all the white blood cells are going crazy. And I'd want to actually draw your attention to the bottom here, which is where it says severe formation of scar tissue. That's the same thing that happens in our bodies, but interestingly enough, from training. So when you're training aggressively to the point of pain and discomfort, and you're causing an inflammatory response, and you're not addressing it, you're actually laying down a lot of scar tissue as well, which will hamper how much range of motion you're going to have in there, and how you're going to basically use your muscles in a way to train and compete properly. And interestingly enough, all this stuff here stems from what's happening to your vascular bed, to the red blood cells, to the white blood cells, to once your circulatory system is infected or affected, it actually causes the same response that we actually even have in COVID. And it causes what is known as a cytokine storm, which basically means there's so much of this pro-inflammatory stuff put into the body that your body can't recover from it, or it takes a long time to recover from it. And ultimately, it could lead to sepsis, which is inflammation or infection of the blood, and it can lead to organ failure. So now, this was from my PhD thesis, and what I am showing you guys here are tumor necrosis factor alpha, and IL-1 beta and IL-6. These are the pro-inflammatory proteins. So when you have an infection, when you train, when you cause DOMS in your body, you are releasing this TNF-alpha, IL-1 beta, and IL-6. This is regardless of how you train, what you train, isometric, concentric, isokinetic, trauma to your body. These things are always released. This is how the body responds regardless. COVID, bubonic plague, Ebola, you will always cause this stuff. The problem is that the anti-inflammatory parts, which is what you see, the other ones, they themselves can't mount enough, basically overcome what's happening with the pro-inflammatory stuff. So this is what a cytokine is. A cytokine is a small protein released by the white blood cells, and depending on the trauma that's being done in the body. And interestingly enough, and we've talked about this in the past, why cytokines are very, very important is, and why you have to be very, very careful when you have an injury in the body, is how you deal with that injury. Because if you actually cause more aggression, more pain, more discomfort, and you already have inflammation in the body, the cytokines respond in three manners. So as you can see, autocrine, which means they can re-release themselves. So this is what's causing this cytokine storm that the medical profession is talking about with regards to COVID-19, which is, severe acute respiratory syndrome. It's basically that the cytokines are going crazy. They're multiplying. They keep re-releasing themselves. They're trying to deal with the inflammation in the area. And you can't mount any of the anti-inflammatory responses because they're being somewhat inundated with all the inflammatory cytokines. The cytokines also can cause other cells to respond in a manner, which is called paracrine. So when you actually have chronic inflammation, you're actually having these two things, autocrine and paracrine, working in a manner where they're actually perpetuating the inflammatory response. And one way to lessen it from an acute point of view is basically trying to stimulate the parasympathetic nervous system. If you don't, and you continue, and now we're talking acute, we're talking training, we're talking competition where you're going to recover. So it's an acute response. If you do not work in a manner where you're trying to lessen the inflammation, you're only going to perpetuate this chronic problem, which is why Hunter was having his chronic issue with his Achilles tendon, because there was inflammation in the system already. So what we tried to do with Hunter is we actually tried to lessen the sympathetic response. We tried to activate the parasympathetic, but more importantly, we were trying to remove as much inflammation from his body as possible, which again, as you remember from our previous talks, once you basically help activate the parasympathetic, then you are activating the most important system of healing, which is sleep, which is what we talked about, your delta brain waves. And those are only stimulated with the first 90 minutes of sleep. That's why sleep is very, very important. And like Tom talked about earlier on, 4 or 5 conversations earlier about breathing. Breathing is very important. Remember when Hunter commented on the fact that he would sit there and all of a sudden he'd take that nice deep gasp of a breath. That's the parasympathetic. The parasympathetic is kicking in at that moment in time. Interestingly enough, what's happening locally? So what was happening at Hunter's left Achilles tendon area was sending a signal throughout the body to the liver. The liver is a metabolic organ, but it also gets involved with the inflammatory response because it releases what is known as an acute phase response protein, which is high sensitivity C-reactive protein. Once the C-reactive protein is released in the body, the whole system gets involved with inflammation. So now it's become systemic. Interestingly enough, with athletes, we recover from that systemic response. But if you've got COVID, if you've got bubonic plague, Ebola, you do not recover from that. So it progresses to the point where then you start getting organ failure. This is where you start getting that cytokine storm that everybody's been talking about with regards to what's happening with COVID. So quickly enough, so in this triangle here, basically you have tissue resolution. So the tissue is responding in a way where it's going to recover, and you're not going to get a lot of fibrotic tissue developing, which is what happens when you move to the acute to the chronic phase, where you're actually going to have that inflammation in there. Your extracellular matrix, ECM, this is basically the environment that the cells are surrounded by, and that's where you develop a lot of fibrotic tissue. And once you have a lot of fibrotic tissue in there, you're not going to have tissue resolution. In fact, you're going to have more, collagen in there that's being released, and your tissue will never recover if you continue on a point of causing inflammation, which is going to lead to chronic pain. So this is the last of the slides, and this is what a cytokine storm looks like. So what you're seeing is all those little droplets in there. They basically are cytokines that are being released by the body to deal with inflammation. So the key is inflammation is an information of the body's response in giving itself the opportunity to deal with what's happening at hand. If that information goes crazy, haywire, like a storm, it's very, very difficult to recover from it from a COVID point of view. But let me tell you, it's the same response that when Hunter trains, when Mike trains, when, you know, Richie recently went to the doctor because his, is it your right hip, Rich? That's that's bone on bone now?
Left hip.
Left hip. Well, because Richie's been putting a lot of pressure on his left side to protect his right hip that he's had earlier on, he had a hip replacement on the right side. These pro-inflammatory cytokines are involved with all this because it's pain and it's a breakdown, and the body's trying to recover from the stimulus or the insult. but it's the exact same response as a person who's got Ebola. Isn't that, I find that very fascinating. This is the one thing why I like doing my PhD, mainly because of how the immune system responds. It's got the innate and the adaptive. The innate is what we have, and the adaptive is what's happening right now with the COVID-19. Our body is releasing all these things to try to adapt to this new insult. And it's the same thing when you actually do DOMS. DOMS is the breakdown of tissue, but that breakdown of tissue releases all these white blood cells that are saying there's damage here. And then it releases what is known as the neutrophils. So these are cells that are in the blood system circulating. And all of a sudden, Hunter's got his left Achilles. All of a sudden, a lot of neutrophils are going in that area to clean up all the damage. And then the macrophages come in to remove all the, for lack of a better image, the neutrophils are now filled with all this damaged cells, and they're starting to die. So the macrophages go in there and they remove them. And it's the macrophages as well that start bringing in all these pro-inflammatory cytokines. And it's that at that particular time that you actually cause the stem cells to be activated. And that's the key with helping you recover from injuries once the stem cells get involved. But if there's chronic pain in there, what happens is you release another cytokine called TGF beta, which basically means transforming growth factor beta. And what that does is it lays down more scar tissue. I don't know if you guys could see this, but this was an accident that I suffered with the chop saw. And what's happened is this is so scarred up that I can't move my little finger. I can only flex it, I can't extend it. But because of the scar tissue in here, my neural system, my nerves weren't able to attach because of a lot of scar tissue. And that scar tissue is the same thing that gets released from when you're doing your training as well. Okay, that was the PowerPoint presentation. And you know what? I think that Uber conference is what killed me. And I removed it. So how was that?
Yeah, you worked perfectly there.
Yeah, I think it was that Uber conference. But that's
You
so.
driving now, Nikos?
What?
You working for Uber now or what?
No. Somebody yesterday's meeting. Thank you, Hunter. Yesterday's meeting, because I actually belong to, believe it or not, a mushroom company. I'm head of research for that, and we're looking at psilocybin, or actually psychedelics. Mike knows about this, and so does Hunter. We've talked about this before. So one of the guys says you need to download Uber Conference, which I think is what killed me. So as soon as I removed it, here we are. But that's the way the body responds. It doesn't matter. Even if you cut yourself, that cut is an inflammatory response, and those proteins all get involved. And like I said, what blows my mind away is it's on a 200-pound person, it's 0.12% of his body weight. These things are just fascinating.
Hey, Nikos, I'm going to leave this running and then I'll shut it down. I got to go to another thing right now, but I'll leave you all on. So y'all can keep going for all if you want to, and then we'll see everybody next week.
Sure. And I mean, and like I said, topics are important. I don't know what we're going to talk about next week, maybe flow or something, but whatever. Oh. And like I said, sorry, Alan, but we're actually in the process of putting courses together. So as much as I would really like to share a lot of I did share with you the Hunter's progression. We're trying to get all this stuff done in a way where it's, packaged and we can teach it.
No, that'd be great. Totally get it. Yep.
Yeah. Okay.
See what Hunter was saying about the relaxation of the micro stretching. I was doing it, I think, 2 weeks ago, and I was going to say last week. I was just doing a little bit on the side while my two athletes were warming up. I totally zoned out, and one of them had to actually come up and ask me a question to bring me back. Totally relaxed, totally zoned out. It was great. And now I'm doing the little bits that I know, just the 3 stretches, with a 55-year-old ex-international athlete who's hurt her left calf. Been doing it for 5 days now. She went out for a walk and her right calf was a little bit tight. She had no pain, no reaction in her left calf whatsoever. So, seems to be working.
She's
So I'm gonna
compensating.
Yeah. So I'm going to try
The
and now
key-
get her to do it later before she goes to bed, so she gets a fuller sleep. Just to see if that's going to make any difference. But the calf she actually tore on a jog, or she said she tore. She gets no pain and no reaction going for a walk in it now. It's the other one.
Huh. I don't know what's happening now. This thing's gone unstable again.
You see ya.
Oh, we can
I
see.
don't know. Like, I mean, because Richie's stopped, it's unstable. But that's the key. The thing that you have to keep in mind, if you guys can hear me, hopefully, is it's got to be done bilaterally. You cannot focus on the issue at hand, because as you alluded to, she felt her right calf, so she was putting a lot more pressure on her right calf. She was compensating. Yeah.
I tell you what, one other thing I found doing the one against the wall, or both the lying down ones.
Yeah.
When I'm doing my right side, I can actually feel my body is out of line, and I correct it. It takes about, if you're doing the breaths, it takes maybe the second or third breath, and then suddenly I feel out of line, which is great because I never thought I was, but I very obviously am. So it's tremendous.
Well,
So
and this is the one thing we said, Alan, is because when you put your body in those positions, you will actually get an indication of how your right side compares to the left side.
Very much so, yeah.
And you'll realize that, like, for instance, that one where you put your leg up against the wall and you cross your leg over, the glute one, the side that actually is tighter, 9 out of 10 times is the side that's actually protecting for an injury on the other side, because you're loading that glute a lot more, which then goes back to what I've said earlier on, is when is an athlete really clear to play again?
Probably never.
That's the question you got to ask. And I mean, this is the one thing why we've been looking at Hunter is because we want to see how he works bilaterally. Like, if an athlete is given the orthopedic assessment and says, yeah, you've got enough strength in there, and you're pushing against an orthopedic surgeon, yeah, you could overpower him. Hunter will throw him up against the wall.
Yeah.
But that doesn't mean Hunter's ready. That's the question you got to ask. So this is why we've been working with Hunter and Derek and myself and the other physios, because we're actually trying to find ways and means of saying, yeah, he's near ready, but not after I've come from an orthopedic surgeon that says, push against me, pull against me. Yeah, okay. You're only using human power, and you're looking at an orthopedic surgeon that's not a lineman, So you're able to basically overpower that orthopedic surgeon. But that's when they say you're ready to go. That baffles me.
I don't think there's ever an athlete on that start line who's 100% fit and pain-free. There's always some issue with an athlete leading up to a race, isn't there?
I honestly, if I had the money and the facilities, and I know Hunter knows where I'm going to go with this one, I would actually have a bilateral force plate. Because that bilateral force plate, when that athlete jumps, you're going to see how unbalanced they are. They will jump more with the powerful leg that's being that's always been protecting the side that's been injured. That is a very, very important. And there was a guy named, I think his name was Paul Fish. Is it Paul Fisher? He's from Jamaica, and they actually, when they train their high school athletes, they do have a, and this is track and field, they have a bilateral force plate. And that bilateral force plate tells them if the athlete is balanced or not. And it's about balance, guys. You know, when the athlete is balanced, he's able to lower his center of gravity to the point where he becomes more stable, and he's able to generate those forces through the hip, which will propel him forward. But if he lowers himself and he tilts to the right side or the left side, and look at a guy who does a squat. If the guy's got an issue with an imbalance and you get him to do a squat, you're going to see, let's say, the right cheek kicks out more. He's not balanced. He's not ready to perform. And get him to do a step up. You're going to know automatically when they do their step ups. You know, step up to what we used to do in track and field, where you'd step on an 18-inch box and then raise the other leg. You'll notice if that person actually, because another thing that happens with injuries, which is very, very important and something that you need to keep in mind with your athletes, is that their proprioception is off.
Mm-hmm.
Their ability to sense how they're placing their legs on the ground, pushing off, is slightly off because of the injury. Because the injury has basically caused this compensation shift where the athlete is protecting, you know, let's say the right knee has been injured. So the athlete's protecting the right side, putting more pressure on the left side. So now the whole proprioceptive system is adjusted to basically, adapt to that change.
Mm-hmm.
So when the athlete is ready to compete again, if you haven't readjusted and allowed for that right leg to fall so that the proprioceptive system is developed, this leg here, which is slightly shorter functionally, not structurally, but functionally, he or she may injure themselves as to when they're landing, they may not be planting it properly. This is what happened with Michael Owen in 2006. He actually thought that he had planted his foot, and when he did plant it, and then when he went to move, that's when his foot planted, and that's when he blew his knee out. His proprioception was off. And that's the one thing that gets affected with all these injuries, these chronic injuries, which is very, very important. So Hunter's doing these things, which Eric's got him to do with pushing off with his Achilles tendons, you know, doing, what did Eric call them, Hunter?
Right now I'm doing yielding isometrics before I go to sleep. Or yeah, either before or after microstretching before I go to bed.
Yeah. Now, the one thing
But I was gonna say, Nikos, I'm sorry to interrupt you.
No, go ahead.
I was able to pull some of the data from my visit to the Rams in November, where I did jump on a force plate, and they have all the data which asymmetries between right and left, and I can email those to everybody.
Yeah, and this is what you see. The interesting thing is Hunter is a student, man, and this is what I like working about him. And same with Mike. Mike and Hunter are very, very perceptive, you know, about their bodies, because this is what athletes are. And Jimson is one of the best people when it comes to knowing his body. I've never met somebody that is so in tune with his body, but it's because they're listening to their bodies. A lot of athletes don't listen to their bodies, and this is where they get into trouble, which is very, very important. Yeah.
I'm also very old, so I have more years experience.
You're not that old. I'm older than you. But no, it's so chrono jumps, iPhone, Ali, what are you talking about?
Yes, the force plates.
Oh, it's called the force plate stuff.
Yeah, you can find it on Chrono Jumps. I actually met the creators of, they're these Spanish PhD track and field junkies. So.
Mm-hmm.
Yeah, so you can look into it if you want force plates.
Oh, for sure.
Some portable ones that are very affordable.
Yeah, portable ones. I mean, out here they're about 20 grand, 20,000. So, you know, but all these tools are very, very important. But the most important tool is for the athlete to be able to be in tune with their body. And that's the key, you know, because when Mike was describing about his experience with micro stretching and how gentle it was, the same thing that Hunter was saying and what Jimson has said, alluded to earlier on, is just that the proprioceptive tissues. Now, proprioceptive tissues are two. So you have what are known as your muscle spindles, which lie inside the muscles and are parallel to the muscle fibers. And then you have your Golgi tendon organs, which lie between the tendon and the muscle, and they're in series with the muscle fibers. Those two, the Golgi tendon and the muscle spindles, are what your body uses to basically get a reading of the environment. And that's the key. And all the readings are taken in the joints. So when your joints are off, when you've got muscle imbalances, when you've got joint centration problems where your joint isn't aligned properly in for instance, in the ball and socket where the femoral head is not in the middle of the acetabulum, which is your socket, and you've got a lot of tightness in your quads, you've got where it's slightly pulling the femoral head forward, that means then that your ball and socket, your socket is being worn down. And this is where you start developing what are known as bone spurs. And those bone spurs are a pre-indication of you're going to get to the point where you're going to have bone on bone. And then you're going to have a hip replacement. So, but it all starts with proprioception. It all starts about being balanced right to left. And that's the key. And this is why we do the stretches bilaterally. This is why we don't say, hey, stretch your left calf and that's it, as Mike alluded to earlier on, which is very important. Anything you want to add, Mike? Come on, Mike. Huh?
No, that's pretty much it. I mean, summed it up right. Just, yeah, make sure that you're doing it both sides.
So what
and...
show?
Yep. Somebody have a question there?
I'm proud. I said you broke up. Anyhow, yeah, I was going to ask a question. Yeah.
Okay.
Because you're saying about both sides being equal. My female sprinter, you can run 7.5 for a 60 and 11.7 for a 100. So when we're doing two-footed jumps on wooden steps, her feet look like she takes off at the same time, but she's obviously putting more power down on the left-hand side. Because when she's in mid-air, her right foot is higher than the left. But then when she lands together, so she can't see or feel that there's an imbalance because she's landing at the same time. So how do I get to make sure she's taking off both power through both feet at the same time and equal distribution of power?
What you should do, Alan, is film her.
Mm-hmm.
Film her front, back, and sideways. And if you film her on the side, you will probably see that one of the feet touches earlier. She might have a plantar flexion with one of her feet. You know, when we got Hunter to do some pogo jumps, you could definitely see a difference with regards to his feet weren't aligned. They were somewhat skewed, where one was landing just slightly ahead of the other one.
Yeah.
She may feel, this is where it goes back to proprioception, or when you were actually doing the stretch and you felt that you were out of alignment. She may feel that she's landing equally.
Yeah. Which is definitely right. There's a thumb at each side. I'm like, okay, thanks.
And Alberto, I didn't have a look at I saw those videos, but I needed to see videos from front, back, and side to get an idea about the jumper.
Yes, I know I can I know one video from is the only one is lateral, the run and jumping, and share with
Yeah,
Richie
I
and
know.
Chase. Do you see the videos?
I only
Richie,
saw her laterally, but I wanted to see her front
okay.
and back because I want to see, because you got to realize if the hip flexors are tight, the
Yes.
interesting thing about when an athlete is running,
Yeah.
the side that's tight is actually does not allow the body to stay square. So it would be something like this.
Sí.
So this side here was tight and this side is not as tight. So when you look from behind, you can see the glute, how the glute looks. And when you look from the front, you can see if the hip on this side is slightly brought backwards, which then means that the foot that's landing on the right side may be externally rotated more.
Okay, I understand. But in this quarantine, I need to take a time to the take a video again. It's a problem for.
Yeah, once the quarantine is gone. Where are you
Yeah.
based? Where are you from?
From Monclova, Coahuila, Mexico. I working in Monterrey.
Are you in Puerto Rico, Colombia, Bolivia? Where are you? Mexico?
Mexico. In Monterrey,
Oh,
Nuevo
Mexico.
León,
Okay.
Mexico. Sí.
Maybe I'll come down to Mexico.
No, Mexico City. It's Monterrey,
But you need
Nuevo
those
León.
you need those different views. Any other questions?
Oh, no. This is the only one you in the jumper for the.
Sorry?
This is the only one question in the last week for the fibrosis. This is the only one.
Yeah, I need to see more images of her.
Okay.
Yeah. So for next week's topic, I mean, what do you guys want to touch upon? Proprioception?
Mm-hmm.
I could put something together.
Very important. Yeah.
Yeah. Yes, please.
Okay. It's proprioception then.
Put a PowerPoint together for proprioception.
Excellent.
You know, Hunter, you're more than welcome to join us anytime.
Oh yeah, okay. I mean, thanks for having me. Appreciate it. Learned a lot.
Yeah.
No, it'd be great to have you anytime. Like, I mean, because you've got a lot of coaches here that, you know, besides Derek, you've got a lot of other coaches as well. So it would be, you know, you can pick their brains.
Yeah. I appreciate the opportunity. So thank you, Richie and Nikos and everybody else for putting this in together and allowing me to be a part of it.
Oh no. Thank you for taking your time to be with us. So next week's topic will be on proprioception.
Yeah.
Proprioception.
Bring questions and hopefully, pardon me.
Good.
Yeah. Sounds good, guys. Thank you. Thank you very much.
Hopefully,
Thank you, guys.
Thank you.